So the first exercise, you're gonna push up from the chair while keeping your surgical leg forward to strengthen your uninvolved leg and your arms for getting up and off a chair safely. Now you're gonna do a mini squat. You'll either hold the back of a chair or a counter and keep your feet shoulder width apart, squat, come up. And you can hold the squat for 5 seconds if you can. 1, 2, 3, 4, 5, and then you'll repeat. 1, 2, 3, 4, 5. Now we're gonna do our heel raises. It's important to get the back of your body strong as well to support your knees and hips. So your feet will be fairly close together and you're gonna go up and down on your toes. Try not to let your feet wing out like this and come directly up onto the bone below your big toe. Perfect. So now you're gonna do ankle pumps. Again, super important for getting the blood flow back up from the affected area and to keep everything loose. So up, down. And you can hold it for 3 seconds up, push down for 3 seconds. Good. And this is a great one to do when you're just watching TV and commercials come on, just pump those ankles. Perfect. So now we're gonna do ankle rotations. This just helps get the leg moving a little bit nice and easy. And again, you can do it sitting in a recliner, in bed, just wherever's kind of comfortable. So you're gonna hold your leg nice and steady and circle your ankle, just like that. And you can change directions if you want. And just make sure the leg isn't rolling in or out. The leg stays put, just your foot moves. So now we're gonna do glute sets. It's just where you squeeze your buns and relax, and squeeze your buns and relax. So you can do this again, laying down, sitting. I'd rather have you do it than not, and so it kind of doesn't matter. So you're gonna squeeze your buns and hold for 3 seconds. 1, 2, 3, relax. 1, 2, 3, relax. 1, 2, 3, relax. So now we're gonna slide your leg outward. Again, we need to get your hip, your knee, everything moving. So you're going to slide your leg outward and come back. Outward and come back. And you can keep this knee bent and your low back pushing down into the mat like you have $100 underneath your back and you don't wanna lose it. Just like that. So now lying on your back, you're gonna keep this knee bent to protect your low back, and you're going to push the back of your knee down into the mat for 5 seconds. 1, 2, 3, 4, 5, relax. And again, 1, 2, 3, 4, 5, relax. So now we'll do standing hip abduction. So you'll stand holding onto a chair, counter, something very stable. Put your weight on your good leg, and the bad leg is gonna go outward and come back. Outward and come back. And make sure nothing funny is happening with the feet, like it's pointed out or in, just nice and forward. And make sure that you're not tipping side to side like a dipping bird. You wanna keep your core straight, like this, instead of sideways. Nice and tall. So now we're gonna work on hip extensions, and make sure if this is after surgery that it fits with your protocol, because there are different protocols for different types of hip surgeries. So if this goes with your protocol, then let's go ahead and do it. So you're gonna hang on to, a chair, a counter, and you're going to kick your leg backward, keeping your spine fairly straight. And don't kick back so far that your spine starts to arch. We just have to engage the back of your body. Good, and you can hold it for 2 to 3 seconds at a time if you want. Perfect. You have to do these exercises pretty consistently before and after surgery so you can make some progress. Do them about 3 to 5 times a day and do them about 10 to 15 reps each.